INISSET exam and will be going to AIIMS New Delhi to pursue MCH Gynecologic Oncology. Many, many congratulations, Dr. SOUMI, on this fabulous result.
Thank you, ma'am. Thanks a lot, ma'am.
This interview is for you to discuss with us your life story. How did you get here? Tell us that. Where did you do your UG and PG from, Dr. SOUMI?
I did my UG from Burdwan Medical College in West Bengal. Then I did my post-graduation from RG Medical College, Kolkata. I passed out in year 2021. We have 3 years of bond posting, which is a must for us. So I did a 1 year of SRship in my mother college only. Then we were posted in periphery for 2 years. So meanwhile, I joined periphery. I was a bit depressed working over there. I was not learning something new. So meanwhile, I took a break from my bond period and I joined fellowship for 1.5 years. I did fellowship over there. I completed my fellowship this February 2024. And then I appeared for Gynae Oncology only. I did fellowship for 1.5 years. And then
yes, which place did you do fellowship? Which institute?
In Kolkata only, medical super specialty hospital. It was a GOI fellowship there, a national fellowship I was doing there. So then I passed out in February 24 and I appeared for INISSET. This was my first attempt though in INISSET. I appeared for NEET SS twice. I didn't get a good rank. Last time I got a rank of 87 and then 101 in my first attempt. So I was not just able to get a seat in
So you did your UG and PG from a college in Kolkata, and then you were preparing for NEET SS. You did not get a good seat through NEET SS, and then just the next INISSET attempt, which was your first INISSET attempt, you cracked it and you've got a seat in AIIMS. So this is like a dream come true. If I was there, it would have been a dream come true.
Yeah.
And aspiring to be an oncologist, to go to AIIMS just with one exam, it's a dream come true. Many congratulations on this. And
you have a great role in that as well.
Yes, start with your story. How did you make this happen? How did all this happen? When did you start preparing for the exam?
For INISSET, I started preparing from February onwards. I used to follow
February
24,
just now. All right.
Yeah, I just completed my fellowship and then I started preparing for INISSET. So mainly what I did was I did all the MCQs basically on all the recalls. I did it repeatedly. And then on the notes, coming to the notes, I read all the guidelines which you asked us to read, the ESGO guidelines, ESMO guidelines, and FIGO. I didn't go much through NCCN. NCCN was very vast. The problem which I had in, suppose I saw a question, maybe that part I did a recall study and then I came back to NCCN.
That's what I've been telling you, that you have to read ESGO and FIGO for INISSET, NCCN is not. It's just for
I just read the footnotes, that from there we get lots of questions. All the footnotes are very important there.
All right, in NCCN.
Yeah, and ESGO guide, after reading the guidelines, then I used to come back to your notes. You discussed all the ESGO guidelines, recent updates you discussed about endometrium, vulva and all. Then after reading the guidelines, then I attended your classes. I was not able to get the live classes directly because I was working as a SR in my periphery college. No, it was not possible to attend the live classes daily, but yeah, that recorded classes, I went through all those. And moreover, what I feel like Berek and Hacker is tough to cover the full book, but I had just 2 reading, but it was not like I know the whole book or something like that, but few tables and all are important. I revised those tables and I marked few important lines. I kept on revising those. Revision is also very important. I just revised twice before exam. In a month, I did a 2 to 3 times revision of all these things.
If students have a lot of time, then they may, I think, open Berek and Hacker and
think because Berek and Hacker is not possible. It's not possible to cover the whole thing.
And since I think it has been 4 or 5 years since the last edition had come. 4 years at least.
And recently they are, what I saw from the question, they are not asking much from Berek and Hacker. They're all asking.
For the last 2-3 exams, they haven't asked
many questions. Maybe for the tables part and chemotherapy part, they are maybe asking.
Yes,
but
chemotherapy, radiotherapy, the basics. The basics of chemo radio. But radiotherapy also, the new concepts have come in cervical cancer ESGO guidelines. Great. So they're asking from SBO guidelines only.
Mainly guidelines only, I think they are important.
Right. Yes. But
Specifically the recommendation part. Yeah, recommendation part is important. Initially, first reading, I used to go through the full guideline, and then from the base, prior to recommendations, the descriptive part, I used to mark few lines which are important. Which I felt that they may ask some questions from that. They asked also because the trials from there, I used to pick up the trials from 24 guidelines, 23 guidelines, recent guidelines. Those trials, and then I studied it in the details. No, it's not possible to get all the trials, no. The trials
yes,
part
when
is
you
from
prepare
those
for
guidelines.
INISSET, one big question is whether not to read the trials.
Yeah, trials actually we did. What I did was from SGO and FIGO guideline. They mentioned the name of the trials. No, only all the phase 3 trials
only
I studied.
Landmark trials. Yes.
Yeah, that's all. It's not possible to remember all the trials. All GOG trials is very tough to remember.
Especially
and I made a notes of the trials. Yeah.
Yes.
From Berekenagar, it's not possible. Trial, you should be making a notes. What are trials of Bev and what are trials of OLAP? For example, no, where I used to jot down in cervix.
A lot of trials we had discussed in the recall discussion just before the exam.
Yeah. In exam also, repeat question was there from trials. Yeah.
So we had a discussion of those MCQs, the previous year recalls, just before the exam.
15 to 20 questions were from recalls only, ma'am. About 15 to 20 questions. Maybe it's not like direct questions, but something related to that topic.
But from the
and AIIMS has a habit of repeating same question. Yeah. And AIIMS has a habit of asking same topic question. No? Endometriosis, adenomyosis. These are the favorite topic for gynae. This time they asked a few here and there questions like UTI in pregnancy and all. They have asked 2 questions from that. But most of the question like from RPL, they have asked few questions in one question from gynae part and few questions like endometriosis, adenomyosis. These are common topics we expect in AIIMS. And paper was this time I felt it was a bit tough, on the tough side.
Yeah. But still, since you have such a good rank, you must have scored the highest in the theory. That is what I'm expecting.
I don't know. They haven't disclosed the theory marks.
That is how it is.
Yeah. This time they give
us how it is. It doesn't depend on departmental assessment.
Yeah.
Did they ask, what was the departmental assessment difficult? Did they ask you any specific questions?
Yeah, they first will ask you to introduce yourself, why you want to take, what are you expecting after becoming an academic SR over here. Then they asked me 2 questions. They were like, what are the recent advances in CS cervix treatment? What changes in management of CS cervix? And one more thing they asked was on Coelho-Moro classification types of hysterectomy. How will you choose the case according to the stage? So I have to go say like this stage I have to do this hysterectomy, this stage I have to do C1, this I have to do C2, like that I have to describe. And they asked me about what surgeries I have done, what exposure I had, whether I have any experience on gynae onco. I think ma'am, I had exposure for one year, 2-3 months, so that has helped me to see, because I feel like seeing a patient is also very important. No, not only not studying. It was easier for me to grasp the concept because I am not.
When you're clinically into that field, reading becomes easier.
Yeah. Because I used to relate those things. I was seeing patients in OPD. I was doing tumor board meetings. I know how they are doing it. So for me, it was easy because I am not that like very nerd. I do all the things. I love to cook. I love to sing. I want to watch series. And in that also I was studying. I was not like into studies. So for me, it maybe I can't study for like long 16-17 hours. For me, it was 8 hours study, and the fellowship helped me a lot.
8 hours, really 8 hours is a long time. 8 hours every day is a long time. Still, nobody studies for 6 hours a day. So, coming to that question, how much time would you give to studying in the last from February, since you said you started preparing seriously?
I had to work for 3 days there in my government posting. Remaining 4 days, I was at home. So during the 3 days, I was not able to study because I was having on calls and all OTs and all. I used to do MCQs when I used to get time in my hospital. I used to do just MCQ. Yeah, or I used to listen to videos. But remaining 4 days, I was completely dedicated to studies. In that 4 days, I just dedicated to studies. Like that time, I used to study 8 to 10 hours. And prior to I took 2 weeks off from my work. Yeah, I didn't go work for 14 days. I just took off. From that time, I was just revising and having like 12 hours study.
What were your sources of studying from February till your exam date?
Mainly guidelines and notes. Nothing apart from that.
The notes
No,
that you
ma'am.
had made.
No. I made topic from you selected, which I used to forget. I made notes of that. Otherwise, the PPTs and all, what you gave us, guidelines and all, only that. Yeah.
That
Only few topic
and
which is volatile I was not able to get. Only that part I made notes of, which I was recapped, not like full notes.
Okay, so this is a message to students that you can read directly from the notes that I've provided.
Yes, ma'am. Sure.
If there isn't enough time, you don't need to write down everything because it is vast.
And moreover, you can add from any MCQ, which is a weak point. You can add 2-3 points to that. That this part, just make a asterisk and mark that part where we used to study from that. Otherwise, it's not possible to make notes of all, because oncology is vast.
Yes. That was very nice. Any tip that you would want to give to the students who are appearing now?
First, go through the recalls. Recalls are very important, ma'am. They ask, you will get 15-20 questions directly from recalls, and guidelines and notes. That's all. No need to study Berek and Hacker thoroughly and all. Just, you must give a read. For me, I just read it once. I didn't revise Berek and Hacker just to get a basic concept, because after doing MS, we don't have much more exposure to oncology. For that, you need to just go through Berek and Hacker once, especially the tables, and after that, for revising part, only notes and guidelines
Notes
and question.
Notes, I really want to hear. Are you talking about reprobate learning notes?
Yeah, your notes, what you gave in ESGO, because that was a very gist, no, and it was very precise. Used to just on the go while traveling, we can go through the PPT, the present notes you gave, no, it's with images and all. It's easy to go through.
So you mean to say that reprobate learning was a good major part of your
Yeah,
the
ma'am,
source
definitely.
of your study?
Yeah, definitely, ma'am. And all the questions you discussed, mainly the questions you discussed, that was very helpful. That vulva MCQ discussed, who were all the 40-50 questions that was in the test series, you used to discuss with us, no, vulva, ovary, last few days before the exam you discussed.
Just before the exam. So just before the exam, just for INISS to get the result, because I always believe that INISS, one of the students will give a good result. So I focus on those topics. So I think I taught vulva, endometrial cancers, ovaries.
Vulva, endometrial, ovary,
and then the recalls. This was for INISS.
Only GTN you said it was, you are going to cover it clearly, because
that is what I am doing right now. Today, all the day, I was preparing GTN notes from FIGO 2021 updates. The questions, 2 questions, I think 2-3 questions are from there.
They always ask from GTN. From NCCN also, they ask few tables.
NCCN is very vast to cover. See, without NCCN also, you getting a seat in AIIMS Delhi.
I haven't read NCCN. I was doing that.
Nobody needs to read NCCN. It is too vast and it keeps changing. They change it 2-3 times a year.
And it describes everything. It's not possible only to cover and remember also.
And it's not specific for gynae-oncology. ESGO is the best.
They have lots of directions. This you can do this you can also do this plus this. So which one to answer?
Memorize
you can understand.
You can't.
And for solving MCQ also, it's very difficult.
Yes. You'll miss the important points if you go after NCCN.
Yes.
ESGO FIGO is all that they need to know.
ESGO FIGO is more than sufficient, and because your notes were also mainly based on ESGO and FIGO only. What notes you gave, that was completely based on that only.
Yes, and a little bit from Berek and Hacker, which I had.
Yeah, few charts.
The basic things from Berek and Hacker.
The basics of chemotherapy and all, that was from Berek and Hacker.
From Berek and Hacker. Wonderful. It is so nice having you over, and I'm so proud of you. INISS now, I'm really proud that in INISS every year we are getting good results. The exam is quite.
No, ma'am, you have done all the hard work for us. It was everything ready in front of us, and we just marked it and nothing else.
Yes, and I really want to repeat that Dr. SOUMI is not from New Delhi, is not from AIIMS, is just like me. Never been to AIIMS, never been to those institutes.
No central institute.
No central institutes, which my husband keeps telling me that I've always been to central institutes, and you're never.
No, I have never been to. So I was very during an interview time also, I was like, everybody says no, AIIMS prefer. They say that AIIMS have.
I have had an inferiority complex for a long time that I have never been to a central institute.
Then I was like also very depressed while giving the interview because I heard about other people who were giving there, one from Jipmer and one from New Delhi only. The other two person were from Jipmer and New Delhi only in my open category. So a day before that, I was so depressed. I said, why they are giving? I will know I won't get chance and all. No? After getting, so it was very unexpected for me. I thought, okay, they are Jipmer and I did from Arjikar. I know Arjikar is best
Arjikar is
from
very good. See, my college from Mumbai was very good, but when I went to Delhi,
yeah.
it was like they didn't know the name of the college. They didn't know anything about the college. So
That's why I
that's
was
what
also
affected
wondering,
me.
have they ever heard about my college name?
Yes,
They were
yes,
thinking,
yes.
where have you come from and all.
Right. So I have given interviews in Delhi, and they were like, when I tell the college's name, and they're like, which place is this? Looking at each other,
That's
which place is this?
and they were like
My
one more thing. What I felt, I felt that they were while I was doing bond posting. No, for them it's like doing bond posting. They asked me which hospital are you working in. So I said in the name of a hospital. It was subdivisional hospital. Okay, so they were like, are you from tertiary care with referral center, or are you from secondary care, or it's a rural hospital? I was like, it was a secondary care hospital. Then I was like, okay, I be saying that in the interview, but anyway, I think you should be very truthful in the interview because I said what I where I am from, not to be, but just be humble and see what they want to listen. Just say those few words only. Just for, then they will ask you if they want to know something else. But
they'll ask you other questions.
yeah. Then
And I
if they
think it
ask you,
doesn't
then only
depend
say.
so much. It doesn't depend so much on your departmental assessment. It depends
Yeah,
on your
maybe
theory. You
everybody
have
is saying
done
that.
very well in the theory. You have done very well in the theory. I have been hearing this for the last 5 years. Whether it is the AIIMS
Maybe
SR exam or
uh,
whatever, if you do well in the
I saw the
MCQ exam,
marks. I saw the marks. They gave the total marks. There was only marks difference of 0.3. I was 60.667, and the second person, I don't know who is it. She was like 60.337. So it was like a difference of. So I don't
that
know
difference
whether
must have been in the departmental assessment. I think they must
maybe
have not given
maybe.
a very good score in departmental assessment.
But
That is why
because
you
I
are
didn't
also
have any publication, ma'am. I didn't have any
right. You have
publication.
got very little score in the departmental assessment, I'm sure.
Maybe
But because of your stage one,
theory.
because you got very good score in stage one,
Yeah,
you have
yeah. I
this rank.
attempted 75 questions there.
Out of
So
80, you attempted 75.
yeah, I attempted 75. A few questions I could have left, but I was like, oh, I know something about the question. So you said, though, if you know something, you mark. So I was like, I marked
Yes.
that. Then I don't know what
So that
about there, but
strategy works.
maybe, yeah,
That
maybe
strategy works.
that's one. Yeah.
Everyone uses that strategy only. You know anything about the question, you know about one option, you
Because
mark
AIIMS,
it.
they have lots of questions which you will be doubtful about two options, no? Like this
Yes.
is also
So you
partially
leave a
correct, this
lot
is
of
completely
questions.
correct. Yes, ma'am?
Yes. So you will have to leave a lot of questions
Yeah.
if you
You are very,
depend on
yeah.
that only.
You have doubt on two questions like this is also correct, this is also correct, and this time no, they ask this sort of thing. Suppose they gave four questions, and then they in the answer they were like, which of the following is correct? Option 1, 2, 3, option 1, 2, 3, 4, like
Oh,
1, 2, like this
that's
they are
very
asking. But I
It's
know
J
one option
questions.
is not correct. Yeah, one option is not correct, I know, but I'm not sure about third option. But then they are going to give that 1, 2, 4, 1, 2, 3. Then now you will get confused. No, you can't just rule out and mark. You should be knowing. So this time, lots of questions, like 3, 4 questions were like that only. Which of the following is correct? They are permutation and combination of all the
Combination.
options. Yeah, it's really tricky this time.
But still, you've got a very good score, definitely. We have a proof that you've got a very good score. I'm so happy for
Yeah.
you, and I'm so proud
Thank you,
of
ma'am.
you. It's nice. Tell me one more thing. When was the first time that you joined Repreneed Learning?
In 2022, ma'am. 22,
22.
yeah,
And you
22.
gave the NEET SS exam after that.
Yeah, I joined 2 to 3 months prior to that. I prepared, but actually I was a bit late in joining. Everything was discussed. I was going through. I didn't get much time. So for 3 months I did. Then I got a rank of 101. So I was depressed and shattered. And I thought I will be doing good, but that time they asked a lot of OBGY questions from
Yes.
basic class to post graduation
Basic
standard
graduate
question. They
level.
asked what we do for NEET PG. Yeah, what we did from NEET PG, and I was like, so many OBGY questions. And I think I am a bit weak in OBGY. That was not my strength. Onco and Gynae was I used to love studying, so I used to do good in that. But OBGY is something always used to mess up with OBGY. That time also I messed it up
That
maybe, so
was
I
a
got a
difficult paper.
bad rank.
That was a tough paper. The 2022
Yeah,
NEET was a tough paper. For me
the
also
other
to solve, to
yeah.
find reference was difficult.
What questions they asked, I was like, where are they asking this from?
Where are they asking from? From their award rounds, or they're making it up?
Yeah,
It was a difficult paper.
Yeah.
even find
Then
reference. Next paper, however, was all right. The NEET SS 2023
next paper, yeah, next
was-
paper, that was good. So I thought I would be getting a good score, but I got a rank of 87 at that time also as well. That was oncology best paper mainly. Lots of questions from oncology they asked that time. OBGY was minimum. Infertility basic questions they asked. But I think NEET SS is much more unpredictable. It's very unpredictable which part we need to stress on, which part we should leave and all. And I find infertility, reproductive medicine very difficult. It